Welcome to this module, where you will learn about communication options including leaked speech while on a tracheostomy. This module will cover the following: how normal speech is produced, the impact of tracheostomy and settings on speech, how to perform cuff deflation, and the various communication options if you're on a tracheostomy. These include augmentative communicative devices, leaked speech, and above cuff vocalization. Normal speech. Speech is produced when air is first inspired and then exhaled from the lungs, moving past vibrating vocal cords. The vibrating air or sound waves are further shaped by articulators, which include our tongue, teeth, soft palate, and lips to produce speech and sounds. What happens when a tracheostomy is inserted? When a tracheostomy tube is inserted, the airflow bypasses the voice box and articulators. Hence, you are unable to produce voice or speech. What can you do to communicate? There are many ways to communicate, even if you're on a tracheostomy. For non-verbal communication, you can write, gesture, and even use eye gaze to communicate. For verbal communication, you can use the electrolarynx to produce vibrations, but in this module, we will focus on the following: leaked speech, and above cuff vocalization to elicit speech. Leaked speech. How to perform cuff deflation for leaked speech? When performing cuff deflation for leaked speech, always inform the patient on what to expect, especially when they're on a ventilator. If the patient has an above cuff suction aid, above cuff secretions should always be removed first using the syringe. Then perform trachea and oral suctioning. Attach the syringe to the pilot balloon and slowly remove 2 cc of air with each pull. Observe the patient to ensure that he or she is not in distress or desaturating. Once fully deflated, perform trachea suctioning again. When patients are not on any ventilatory support, leaked speech is easier to produce, as they are able to utilize the expiratory breath to produce speech. When patients are on ventilators and are attempting leaked speech for the first time, they often find it challenging, as the method of producing speech is different from what they are used to. Normal speech is usually produced using the expiratory breath, but leaked speech is produced on the inspiratory breath. It is possible to adjust ventilator settings in order to improve overall ease of producing good speech. The speech therapist can work with the respiratory therapist to identify what parameters should be adjusted. For patients who are stable and on chronic tracheostomy and ventilator, a non-cuff tracheostomy tube can be considered for such patients. Above cuff vocalization. As the name suggests, this process requires a pot where airflow can be introduced above the patient's cuff. Hence, an above cuff suction aid is required. How to perform above cuff vocalization? Before performing the task, it is important to inform the patient of the task. This includes possible discomfort from the airflow and secretions coming out from the mouth. First, remove all secretions above the cuff using a syringe. Then connect medical oxygen via an oxygen tubing with a thumb port. Set the flow rate at 2 liters per minute. Next, occlude the thumb port with your finger and ask the patient to blow out and speak. If his or her voice is inaudible, increase flow rate 1 liter at a time until the voice is heard. Do not go past 8 liters per minute. The task should be limited to 15 minutes of use. Performing above cuff vocalization can be uncomfortable at first. This is because the use of continuous airflow can cause distress to the patient, especially after being on a tracheostomy for a long time. During the trial, it is important to monitor the patient for the following: signs of facial or neck swelling, air leak, or trauma to the tracheostomy stoma. Thank you.